Hi, this is Gordon Brown at Therapeutic Movement Seminars, and this is a short trailer we put together to give you a visual representation of our 2-year continuing education program resulting in certification as an orthopedic movement specialist. This program is primarily designed for rehab professionals, physical therapists, physical therapy assistants, occupational therapists, and occupational therapy assistants, though other healthcare professionals with an interest in musculoskeletal conditions are certainly welcome. As you may already be aware, the American Physical Therapy Association adopted a new vision statement in 2013, transforming society by optimizing movement to improve the human experience. In light of this acknowledgement of the primal importance of movement training or movement optimization to our profession, we would like to invite those interested in advancing their understanding of human movement to join us. This course, at its core, is about understanding and facilitating integrated movement and body awareness. It emphasizes coordinated, whole-body organization and conscious mindfulness related to movement. Integrated movement refers to relationships among parts. It implies that the whole is more than merely the sum of its parts. Integrated movement training suggests that, at some point in the rehabilitation process, we need to progress beyond isolate and localize ideas, like isolated muscle strengthening exercises or isolated joint mobilization, and utilize treatment paradigms and techniques that address these relationships in ways that optimize real-life, functionally relevant movement patterns. This philosophy has gained steam in recent years and is appearing in the literature under the term regional interdependence. A nice overview of this emerging rehabilitation principle is an article by Suki, Cleland, and Weiner titled A Regional Interdependence Model of Musculoskeletal Dysfunction, Research Mechanisms and Clinical Implications. This excellent article outlines the basic premise of regional interdependence. This is connected to that, and limitations or dysfunctions distally affect tissue health locally, and cites several research articles illustrating this principle. But while a step in the right direction, simply knowing that hip restrictions can contribute to low back pain, that thoracic imbalances can create cervical dysfunction, or that hip weakness leads to knee impairments is not in itself enough, even if we go on to address these restrictions, imbalances, or weaknesses locally. What is called for is an integrative approach to corrective exercise and manual therapy that simultaneously addresses the relationships between the various parts, and this calls for a fundamentally different movement paradigm than that which we have traditionally used. We can refer to this principle of integrated movement training as pattern specificity, meaning we should be making our exercise, manual interventions, postural instruction, and movement training look like the optimal movement pattern we are aiming for. This course is then designed to help you to better recognize these relationships, to develop the eye to see and the language to describe these patterns, as well as specific training techniques that facilitate patient extrapolation of our pattern-specific exercise to activities of daily living, improving or optimizing how they sit, bend, reach, walk, climb stairs, carry groceries, and so on. These specific training techniques, or how to teach what we'd like them to adopt in terms of movement or postural patterns, include change of venue, doing the same pattern of movement in different positions or with different functional contexts to help with patient pattern recognition and problem solving. Application of constraints, or positioning techniques that constrain movement in hypermobile areas or reducing muscular work in hypertonic areas while simultaneously funneling movement to hypomobile places and work to underperforming muscles. Link to functional activity, linking into exercise and intention to orient, locomote, manipulate, transition, balance, and so on. And reciprocating movements, or alternating oppositional patterns of movement to balance antagonists and to coordinate synergists locally, regionally, and globally. Furthermore, since we don't have the access codes and cannot make our patients change their movement or postural habits or compensation patterns towards something more optimal, we need to train our patients in movement mindfulness or proprioceptive acuity. We do this with specific language, manual cueing, demonstration, and deliberate contrast of optimal and suboptimal movement patterns. We provide conditions in which our patients can learn to pay attention to their bodies and to make informed decisions about how to best organize themselves to minimize pain and maximize function. We will be borrowing from various exercise disciplines that we can call dynamic integrated movement systems. These systems include Feldenkrais, Tai Chi, Yoga, Qigong, and others that are distinctly different from the static integration kind of an approach that we've been using recently. But rather than adopting a purist approach, we will be cherry picking, gleaning rehab useful movements and teaching techniques from these systems, then medically articulating them. What are they teaching us? What is the muscle breakdown? What are we going to use each movement for? And when are they going to be contraindicated and why? In short, this course is about what to teach and how to teach it. Since learning about movement is best done through personal experience, you will be participating in movement, as well as observing others and analyzing what you see with an eye toward principles of optimal movement, which include appropriate distribution of movement, proportional use of synergists, fascioskeletal weight bearing, and minimization of unnecessary effort. In addition, you will participate in partner and group work to practice teaching and observational skills, and will learn a movement-based manual therapy technique that is both professionally effective and personally rewarding. This course is fun, interactive, instructive, unique, and collaborative, almost certainly very different than what you have encountered in the Con Ed world so far. So come, take a plunge, join with a group of movement-minded individuals dedicated to quality patient care, to honing your craft, and to advancing our profession into the 21st century. Thanks for listening, and thanks for considering Therapeutic Movement Seminars.